In this in-service training video, we will provide information about the Philips infant developmental positioning products, including an overview of each positioning aid, as well as basic demonstrations for positioning a newborn in supine, prone, and side-lying positions. This video is not a substitute for the instructions for use for any of the positioning products demonstrated. Therefore, prior to its use, you should consult that product's instructions for use for more detailed information about any of the procedures demonstrated. In its neonatal integrative developmental care model, Philips identifies 7 core measures that is a framework for neonatal developmental care. The overlapping petals demonstrate the integrative nature of developmental care as a guide for clinical practice to support the delivery of neuroprotection. The petals represent the core measures, while the center represents the healing environment core measure, which supports the developing sensory system. Positioning and handling is key to neuroprotective care development, as it can influence neuromotor and musculoskeletal development, physiologic function and stability, skin integrity, thermal regulation, bone density, sleep facilitation, and brain development. In utero, the infant is flexed, midline, and contained with hands to the mouth in a soothing and comforting environment. By utilizing developmentally supportive products like Philips positioning products, the aim is to support the infant in a position similar to that in utero. The immature nervous and musculoskeletal systems are capable of positive or negative outcomes depending on positioning support or lack of support. With the rapid growth of these systems, inattention to alignment can contribute to striking positional deformities in the skull and extremities in a remarkably short time. There are a number of positive benefits to achieving good positioning: promotes improved rest, supports optimal growth, helps to normalize neurobehavioral organization, increases the infant's sense of security and support through containment and decreases stress, makes infants calmer through containment, requiring less medication, and helps them gain weight more rapidly, supports self-regulation behaviors. In this section, we provide a summary of the different Philips positioning aids and their purpose. These products include the Snuggle Up, Bendy Bumper, Frederick T. Frog, Prone Plus, Jelly Donuts, and Squish On. The Snuggle Up offers a soft, cozy nest that helps to provide proper positioning and physiological stability for preterm and ill babies. Its padded foot roll and soft adjustable straps allow movement while gently maintaining appropriate positioning. Bendy bumpers are flexible positioning aids that stay in place until reshaped to promote containment and flexion, providing a reflex stimulus for extremity extension and recoil. Designed by a NICU nurse, Frederick T. Frog's design mimics comforting hands to provide support around the head and neck, or as tactile support to help achieve clinicians' goals for developmentally supportive positioning. The Prone Plus provides ventral support to infants with a comfortable hourglass-shaped pad. It helps support newborns in the proper prone position by using gravity to facilitate natural rounding of the shoulders, hand-to-mouth coordination, and head and trunk alignment. It also provides standard and consistent prone support while helping to maintain a secure, balanced, and flexed position. An exceptionally soft skin combined with a unique gel formulation make Jelly Donuts soft, yet supportive. They can assist in alleviating pressure, which can result in head molding. Squish On 2 and 3 provide a soft, pliable surface to support the infant's head and/or body. They are designed to help relieve pressure caused by prolonged immobility and other conditions where frequent handling may be contraindicated. The rectangular shape allows for movement while maintaining a supportive surface. It's made from a soft material and filled with a non-toxic gel. Squish-On 2 supports the extremely low birth weight infant, while the Squish-On 3 is for older preemies and babies with more resilient skin. Also available is the gel-filled Squish-On mattress, which provides a soft surface designed to help relieve pressure points, protect fragile skin, and encourage proper positioning. Caregivers can reposition the infant and shift pressure points without having to handle the infant. Using these positioning products, you can create prone, side-lying, and supine positioning to promote infant well-being, which we cover in the next section. Consult your hospital physical or occupational therapist for assistance with correct positioning and flexion. When an infant is placed in the supine position, the positioning aids can be used to support flexed and midline orientation. Select a snuggle-up, bendy bumper, and jelly donut in the appropriate size. You may additionally choose to use a Frederick T. Frog or Squish-On 2 or 3. For thermally unstable patients, pre-warm the gel in an incubator, under running water, or with a warming pad. Once warm, the positioning aid will remain at the approximate temperature of the incubator or the ambient air temperature of the warmer. If using a Squish-On 2 or 3, insert it into the back of the snuggle-up. Cover the gel with a disposable cover before patient use. Using hand containment, hold the infant in midline flexion. Flex the infant's legs and hips deep into the pocket of the snuggle-up, keeping feet, legs, and hips aligned. Continue to use hand containment, following the infant's cues. Tuck the infant deep into the snuggle-up so hips are flexed, knees are in alignment with ankles, and feet are in neutral position. The head should be midline with the chin, slightly tucked, and the shoulders rounded with the hands to mouth. Keep the infant's hands at the face for self-comforting. Place boundaries, such as a bendy bumper, to maintain the neonate's extremities close to the body, with shoulders gently rounded forward and elbows in slight flexion. Flex and abduct the neonate's hips slightly. Align the legs with the trunk, with knees slightly flexed, to encourage flexion and natural resistance against the boundary device. Adjust the straps to provide containment, while also allowing for dynamic movement at the hips first, then the shoulders. Frederick T. Frog can augment the bendy bumper for support. Moving the adjustable beads creates the appropriate boundary height. It's important to remember that Frederick T. Frog is designed for weighted support, so do not place its full weight on the infant. Note that if the infant kicks their feet over the foot roll, this indicates that the infant is either not tucked deep enough into the snuggle-up or needs to advance to the next size. You can also use the Frederick T. Frog to help with support. If on intraventricular hemorrhage protocol, you may add a Freddy to provide comfort and add additional support to prevent movement of the head. During phototherapy, if overhead lights are in use, twist the straps to make them smaller and minimize the amount of space they occupy, or remove them and tuck them under the snuggle-up. If panel phototherapy is in use, you may turn the snuggle-up around and use a bendy bumper at the feet to accommodate the cable between the panel and the light source. When positioning is used with a mechanically ventilated patient with a CPAP device, position the infant appropriately in a snuggle-up, as was demonstrated in the supine positioning. If using a bendy bumper around the head and torso, ensure that it does not interfere with the tubing. A Freddy can be used to support the head in place of the bendy. Surround the head with the Freddy hands to support midline position, as well as provide a support for the CPAP tubing. 2 Freddys may be used as support for the CPAP tubing, if necessary, by laying the Freddys under the tubing to prevent the tubing from being pulled. For intubated patients, there are no special considerations to be made in the supine position. The side-lying position promotes proper alignment, improves visual awareness of the hands, and encourages hands to midline movement. Select a Snuggle Up, Bendy Bumper, and Jelly Donut in the appropriate size. You may additionally choose to use a Frederick T. Frog or Squish-On 2 or 3. For thermally unstable patients, pre-warm the gel in an incubator or under running water, or with a warming pad. Once warm, the positioning aid will remain at the approximate temperature of the incubator or the ambient air temperature of the warmer. Cover the gel with disposable cover before patient use. While maintaining a flexed position using hand containment, place the infant on their side, providing support to the head while aligning the shoulder and hip. This alignment is key. Flex the infant's legs and hips deep into the pocket of the Snuggle Up, keeping feet, legs, and hips well aligned. In this way, the Snuggle Up mimics the uterine wall. Challenges of the side-lying position are proper alignment. Attention needs to be focused on keeping the shoulders rounded and neck slightly flexed, facilitating positioning so the infant's hands are near his or her face. Hips should be aligned and softly flexed, with the feet lightly braced. Add a bendy bumper, making sure to match the boundary height to the infant. Adjust the straps to provide containment, while also allowing for dynamic movement at the hips first, then the shoulders. Follow the infant's cues. In addition to the bendy bumper, you may add a Frederick T. Frog to enhance stability and containment. Do not place the Frederick T. Frog's full weight on the infant. For positioning with a mechanically ventilated patient, place the bendy bumper in a C shape around the infant. If the bendy bumper is interfering with the CPAP tubing at the head, bend the bendy into an angle to accommodate the tubing, or adjust the C to be behind the CPAP. If using the Frederick T. Frog, adjust it around the tubing as needed. For intubated patients, you can use a Frederick T. Frog to support head position. You can utilize the Frederick T. Frog as a place to rest the endotracheal tube to relieve tension from around the mouth, and you can add a bendy bumper to support the head position. Prone positioning provides support that assists in maintaining flexion of the hips and shoulders, similar to what the infant experiences in the womb. Select a Prone Plus, Snuggle Up, and Bendy Bumper in the appropriate size for this position. Add a Frederick T. Frog as appropriate. Position the Prone Plus from above the umbilicus to the head, no wider than the infant's nipple line. Hold and slowly rotate the infant to a prone midline position. Ensure that the hands are toward the mouth for self-soothing. Be sure the hips are rounded and the feet are placed in the Snuggle Up. The infant should be supported from the top of the head to the navel. The hips should be flexed. The elbows should be tucked into the indentation on the Prone Plus to support rounding of the shoulders and hand-to-mouth movement. Adjust the straps to provide containment, while also allowing for dynamic movement at the hips first, then shoulders. Moving slowly, following infant's cues, and round the bendy bumper to rest against the infant's head to comfort and contain. The bendy bumper continues around the back and outside of the Snuggle Up. If the infant arches his or her head and neck, Frederick T. Frog's hands can assist in containment. It's important to remember that the Frederick T. Frog is designed for weighted support, so be conscious of the amount of weight placed on the infant. Never use the Prone Plus without a 360-degree boundary. The bendy bumper is the only Phillips positioning aid that will allow the infant to maintain appropriate alignment of the shoulders and hips. No gels should be placed under the Prone Plus. When positioning the CPAP or mechanically ventilated infant in the prone position, use as a C shape, which allows for the opening to be at the point of the endotracheal or CPAP tubing, and utilize frogs to support the body at the open side of the C. This completes the in-service video on the Philips Infant Developmental Positioning System. For complete information regarding the proper use of the products, related specifications, and cleaning, maintenance, and service, please refer to the Instructions for Use manual for each product. If you have any further questions or to request the Infant Position Assessment Tool, IPAT, please call your Philips Newborn Solutions Clinical Sales Specialist.